Hi, Dr. Bentley. Cole Trotter here.
CJ Hornback,
Reese Wilson,
and Rebecca Picking, and we're going to be discussing Candida albicans.
Candida albicans is the most frequent species of Candida infecting humans. Its taxonomy starts with kingdom is in the fungi. It's in the phylum Ascomycota. Its class is Saccharomyces. Its order is Saccharomycetales. Its family is Saccharomycetaceae. And its genus, Candida, and the species is C. albicans.
Candida albicans, also known as Monilia, is a fungus that is normally present on the skin and mucous membranes, for example, the vagina, the mouth, or the rectum. It becomes an infectious agent when there is some change in the body environment. And an example of change in the body environment would be a pH change, a chemical imbalance, or an overgrowth of lactobacillus.
as Rebecca stated, in humans it's found in the mucous membrane and on the skin. It's also found in the environment, on flowers, leaves, water, and soil. It can be transmitted from person to person through sexual activity, or if the person has a weak immune system, or the use of antibiotics from contaminated medical devices through the bloodstream for IV users. And other triggers are the overuse of alcohol, antibiotics, tap water, too much sugar in the diet, such as wheat, fruit, starches, and starches. Once these foods are broken down, they become natural food for the intestinal yeast.
there are many symptoms of candidiasis. Some are more obvious than others. The first is thrush. It is common in the immunocompromised, the elderly, and infants. At the beginning of this presentation, right here, here's a picture of what thrush looks like. It is pretty much an oral yeast infection where white spots and redness inside the mouth and on the tongue are common. People with thrush often have sore throat and difficulty swallowing. We typically know candidiasis as yeast infections, and they can infect different populations differently, such as women, infants, or males. Yeast infections in women specifically are more common in the vagina, and they are characterized by extreme redness, itching, and soreness, as well as a white, clumpy vaginal discharge. Also, people with candidiasis and these yeast infections develop skin issues such as eczema, psoriasis. They commonly have hives or different kinds of rashes, and women specifically developed irritability, mood swings, anxiety, or even depression. In men, candidiasis usually shows up in the penile region and is characterized by a red rash on the penis, accompanied with itching and burning. It is more common in uncircumcised males due to the extra foreskin that is present. In infants, the rash that candidiasis produces is dark red in the diaper area, and it has yellow fluid-filled lesions that break open and become flaky. Candidiasis can even produce invasive symptoms such as fever and chills, and occurs in the bloodstream when it is infected. The invasive candidiasis usually occurs in people that have either been in ICU, have a medical device such as a catheter. They are immunocompromised and they either have like HIV or AIDS or just had a major surgery. There are many treatment options for candidiasis, such as antifungal prescription medication such as diflucan and ketoconazole, vaginal cream or suppositories, gentian violet, or some cases even require surgical drainage.
This organism is a yeast-like fungus with budding and filamentous forms. It can cause a wide range of clinical infections, ranging from mild and acute superficial infections to fatal disseminated disease. Superficial candidiasis is the most common form. Candidiasis predominantly causes spongiotic changes in the upper layers of the epidermis. It typically causes mild spongiosis and acanthosis, which is inflamed tissue due to the abnormal levels of fluid in the skin. The fluid is easily identifiable by the acanthosis, or the dark pigmented areas of the outer skin. The characteristic feature of Candida albicans is the presence of neutrophils in each of the upper layers of the epidermis. The neutrophils form small collections and build up in the stratum corneum.
Other interesting facts. One rare symptom of Candida albicans is Candida of the nails, and this is seen in the picture right below. There's the ELSA saliva test, which tests for antibiotics against Candida albicans in saliva. As previously addressed, the use of antibiotics may have predisposed humans to candidiasis because they would kill the microbial agents that normally fight off the fungus.
Thanks for your time. I hope you enjoyed our presentation. Our works cited is the next slide. Enjoy!